EMS providers, have you ever had a patient wake up during the course of a cardiac arrest? You're doing chest compressions, starting IVs, giving oxygen, giving medications, doing all the typical cardiac arrest treatments, and all of a sudden you note purposeful movement from your patient. That could be in the form of them grabbing at your hand, trying to get you to quit performing CPR on them. It could be that they open their eyes, or maybe even they talk to you. Before you go and say that this would indicate that you're doing CPR on a person that's already alive and doesn't need it, let's talk about it. There is a rare but very underreported phenomenon called CPR Induced Consciousness. And my friend Dr. Alex Jabbar from Emergency Resilience just launched a continuing education course all about it. But this phenomenon essentially is when a patient is pulseless, dead. They are in asystole, maybe ventricular fibrillation, VTAC without a pulse, but nonetheless, a cardiac arrest patient is having chest compressions performed on them, and they awaken, maybe to a semi-conscious state, maybe fully conscious and talking, but they can perform purposeful movements. And as soon as those compressions cease, the patient's consciousness or semi-consciousness will go away as well. It's thought that the chest compressions are perfusing the brain well enough that these patients get into that semi-conscious or fully conscious state and can make those purposeful movements or even have the capacity to speak. But as soon as those chest compressions cease, or shortly after they cease, these patients go unconscious and are pulseless once again. And before you doubt this, because maybe you've never seen it or it just sounds a little too crazy to be true, I understand. But this started being reported as far back as the 1960s, and they haven't stopped reporting it. And chances are, if you work with several EMS providers, you might run into somebody who's witnessed CPR-induced consciousness. It is severely underreported, and as fascinating as this phenomenon is, it actually poses quite a few issues for fire departments, EMS services, emergency rooms, anyone involved with doing CPR on a regular basis in which they may actually witness something like this happen. And that's, what do we do for these patients? CPR is a pretty barbaric but necessary procedure and can cause a patient quite a bit of pain. Normally we think, oh, this patient is not conscious, they are dead, it's not a big deal. But if our chest compressions are perfusing their brain enough that they're waking up and they're feeling sensations of pain, we need protocol or possibly sedating our cardiac arrest patients in these cases. And like I said earlier, Alex from Emergency Resilience just launched a course all about CPR-induced consciousness, and you really, really need to take it. It dives into what the phenomenon is. It dives into case studies dating all the way back to the 1960s. It goes into ethical dilemmas that come along with CPR-induced consciousness. And one of the other things that it had in there that I didn't expect it to was actual videos of CPR-ISC happening in real time. It truly is a fascinating course, and one that I think is going to change protocols for the good in the future. Because if we can acknowledge that this can happen to our cardiac arrest patients, then we can team up with our medical directors, we can get with our services, our fire departments, and we can come up with protocols and treatments for these situations. So now, I gotta know, if you are an EMS provider or in healthcare, have you ever seen CPR-induced consciousness? If so, tell me about it.